In this video, we're going to learn how adjusting our carbon dioxide can radically improve our function. So let's dive in. Decreasing carbon dioxide is incredibly simple. Just breathe fast and deep, or hyperventilate for all you nerds out there. This simple trick not only teaches our system how to respond to low carbon dioxide, but also educates it on how to handle alkaline environments. When our carbon dioxide levels begin to dip, it can induce a dreamy-like state, accompanied by bizarre sensations and depersonalization. And because of these effects, hyperventilation has been used as a tool for psychological breakthroughs. To help bring this concept to life, let me tell you a quick story. Cultures in the East have been using the breath to alter consciousness for thousands of years, but oddly enough, this practice never caught on in the West. That is until the famous psychotherapist, Dr. Stanislav Grof, stumbled across hyperventilation out of necessity. But before this epiphany, Dr. Grof was giving LSD to his patients at Johns Hopkins to achieve psychological breakthroughs.
Groovy.
This worked because LSD, along with other psychedelics, alters how we perceive reality, which can give new insights that lead to transformative experiences. Unfortunately, when President Nixon used drugs as a political ploy to enact his famous War on Drugs campaign in the early 1970s, Dr. Grof was left high and dry. So if he wanted to keep helping his patients achieve psychological breakthroughs, he would have to get resourceful. While pondering over a drug-free option to alter consciousness, Dr. Grof recalled that some of his LSD-infused patients would breathe rapidly before a breakthrough experience. So his inquisitive mind wondered if hyperventilation could generate altered states of consciousness. He put this idea to the test and discovered that prolonged hyperventilation did in fact alter consciousness and generate psychological breakthroughs. After some fine-tuning, this mind-bending technique was coined holotropic breathing, which entails 20 minutes to hours of mild to moderate hyperventilation. Dr. Grof's work with low CO2 made me wonder, what would happen when we suddenly increase our CO2 levels? Well, it turns out that inhaling 5 to 65% carbon dioxide generates a completely different response. Instead of those expansive dreamlike states found with low carbon dioxide, breathing high levels creates feelings of suffocation and panic, highlighting again the dualistic pattern of nature. Anyways, aside from a natural high, brief periods of low carbon dioxide can generate some impressive benefits. For instance, evidence shows that hyperventilating for 20 minutes can boost our white blood cells and improve immune function. Just in case you missed that, allow me to rephrase. We can voluntarily improve our immune system by breathing alone. Granted, the boost only lasts a few hours, but it speaks to the power of tapping into our ancient pathways. Now, if immune function isn't your cup of tea, how about hormones? Evidence shows that hyperventilating for only 3 minutes can jack up our growth hormone by 5-fold. That's 500% in just 3 minutes. Plus, growth hormone is often touted as a fountain of youth because it affects memory, repair, fat metabolism, sleep, immune function, and a long list of other benefits. But sadly, this hormone decreases with age. Now, before rushing out to your nearest hormone doctor/dealer, keep in mind that anytime we supplement with outside sources of hormones, our bodies will decrease their own production. So perhaps it's best to boost our internal stash with adaptive medicine. All right, the reason growth hormone spikes during hyperventilation is because the drastic change activates our adaptive pathways. And when these ancient pathways come online, our bodies unleash all sorts of compounds to help us adapt, including increases in the following: growth hormone, antioxidants/anti-inflammatories, nerve growth factors, cortisol, dopamine, stimulants, and several other compounds that improve function. The key insight here is when we activate our adaptive pathways with environmental hormesis, our bodies will give us a functional boost that impacts every aspect of our being. And when we unlock this on a daily basis, transformation is inevitable. Now, Keep in mind that these benefits come from briefly stressing our system with environmental hormesis. But if this stress of low carbon dioxide persists, dysfunction will creep in. For example, prolonged states of low carbon dioxide have been linked to an increased risk of panic disorder, seizures, ADHD, and asthma, among other unsavory conditions. But there is good news, because all these conditions can be improved or reversed by increasing our CO2 tolerance, which we will dive into in the next section. On a final note, breathing through our mouth has been shown to be a low-grade form of hyperventilation, and as such, it is associated with several diseases, but that's a topic for later.